So once all these things happen, in a small little bracket, you can fix how to heal or how to prevent this. First is therapeutic intervention, because now you have identified these are the things that had happened. Some people go for family therapy. In India, it's not really a concept. I was talking to somebody for a family therapy, but their other members did not agree. And then mindfulness and stress reduction, meditation, yoga. Meditation and yoga will help only when you know where the problem is. Then developing coping skills. Now, please understand, only one thing will not help us coming out of this. So there are multiple things. So when I say that journaling has reduced my skin issues, only journaling has not reduced it. So I have applied, for example, oil, the coconut oil I have applied, because there's something that you need to do, but I have not added any of the medicines. So that is also something which is important. So what are you eating? What are you thinking? So what is the person's name? Sister Shivani. She says, what are the thought that you are having? Even that causes you illness. So we will come to this part in detail. Now, what is the link between trauma and mental health? Here, there are four things which are there all in all. First is anxiety disorder. Trauma survivors might experience panic attacks, constant worry, hypervigilant. For instance, someone who has been in a car accident might develop a fear of driving, which is fine. If you were not even born and your parents, one of the parents have that fear because they either witnessed an accident or they had been in an accident, you might develop the fear, right? So that anxiety disorder or identifying those anxiety disorder is also important. Find out how can you trace those things. Okay. Then we have depression. Like I said, sometimes people say that depression is also from one generation to another. Another session that I had taken yesterday, that person told me that his Chacha ji had a mental illness and now his daughter also has the mental illness. This is something which is important for us to know, that even if it is a mental illness, it is not genetic if the person knows. So I asked him to ask the cousin if she has experienced anything bad. And let me tell you this wonderful incident or event. So my mother has this beautiful best friend who lived across her house. And they were like bachpan ki saheliyan, childhood friends, right? And then auntie used to come to our house every time. I mean, to her house, not our house. She was not even married. So to her house every time. They were really good friends. And then when auntie was around 16 years of age, she got something called as in our culture we called it as bhoot. She got possessed. So Ma tells me that she was really good, but when she got possessed, she used to eat so much of food. Like for 8 people's food, she used to eat on her own. Right? They had a big mango tree. No, mango tree, nahi, kathal, jackfruit. So she used to climb the jackfruit tree, and she had long hairs. So all that hair, and then she's sitting on the tree, and then she's looking down, she's doing all those things. Now think about this, how scary it might be. Her eyes were red. Generally, she was not talking in Telugu, but when she got possessed, she used to speak in Telugu. Now, this is a very typical case of being possessed, right? In Bhoot movies, also, we have seen in ghost movies, this is how people are possessed. And then Ma said that for some reason, I was not really scared of her. I felt very bad that she's sick or something. So when auntie had those red eyes and those long hair, and then she's just sitting like this and doing all this, Ma used to go near her, and then she did not do anything to Ma. But she used to beat other people. Now, this happened when she was 16 years of age, and then some Jhadfuk Baba came and then he beated her and all those things. And then it was found out that some spirit has possessed her who has come from some place, blah, 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 some place in Andhra. So she was married to somebody in her childhood days. And then when she grew up at 16, she did not want to go back to that family. So apparently that family had did some kala jadoo and then she got possessed. Finally, that booth went and auntie became normal. Auntie used to say this thing couple of times to Ma that you are so nice. If I would be a boy, I would always marry you. In friend circle, we talk like this. So it's nice. And then later on, what happened? Ma got married, auntie got married. Then Ma heard this news that auntie is in mental asylum. And then she came back again to her house. Ma went, met, she was totally normal. And few years back, auntie passed away in a mental asylum itself. Now, when Ma was telling me, Ma was crying because it was her best friend. And then I told Ma that, Ma, you're telling me all this, but this does not sound as a booth or something. Can you tell me if anything happened in her life, traumatizing? She said, yes. She told me this in a very sad way, that auntie's father used to sexually abuse her when she was a child. And auntie's father used to also say this, तुमको दूसरों के लिए थोड़ी पैदा किया है, खुद के लिए पैदा किया है. Now understand, a child goes through this traumatized event in her childhood. She could never say this to anybody. And later on, this traumatizing feeling is something which was killing her because she could not say this. She shared this event when after marriage, after 2 children, auntie had come and Ma and auntie had met. Right? And because she had experienced that childhood traumatic event, this thing affected her. So if you have seen the movie Bhool Bhulaiya, even that Vidya Balan was there, and she also goes through a traumatic event when she was in 10th standard. And then she falls into it. So any mental illnesses which is there is coming from an event which is really sad and traumatic, and they cannot share it to anybody. That is something which causes so much of trauma that the brain starts malfunctioning. Now, that booth comes and then, being possessed and all that, we will not go into that part. But when this is something happens, this something I was watching this podcast by one of the so-called tantrics, and he also mentioned that 90% or 95% cases are of mental illnesses. They are not of possession. So if somebody has severe mental illness, there might be something traumatic has happened to them or to a previous generation. And this is also something that I have found in my research, that people who are of LGBT community, especially the homosexuals, most likely they have been sexually abused by the same gender person. So if you are experiencing sexual pleasure by the same gender, that is a feeling that you will like and you will remember. And later on, you will start liking the same thing again, right? So it can manifest like this, that you can become a homosexual, or because you were sexually abused by the opposite gender, you will not like the gender at all. And then you will fall in love with your own gender. So that is also there. Obviously, there are natural become homosexual, but this is also something that I have found in my studies, that 90% of the homosexuals have been abused by the same gender people. So if at all you have a future generation, and when you're planning your child or baby, make sure that your child is protected. If something happens to your child, the child should also come and talk to you that this has happened with me, right? Because what happens, we become so loving, so caring, but we forget to mention this part, that if somebody does something to you, please come and tell me. And don't worry, I will not be angry at you. So those sentences are being told because children are very sharp. They don't want to hurt the parents. As a child, you have done so many things and you didn't want to hurt your parents out of goodwill. but you still hate a lot of things, right? So this is how it comes. Then we have substance abuse, other mental health condition, or even PTSD. Any event which is traumatizing for you and you have never shared it with anybody else, that is something which comes back in the adulthood again. So we need to figure this out. This can be something where you felt, no, I am a very good person. I was not supposed to cheat on that exam. It's a small little test or exam that you cheated on, but you never shared, but you always hated yourself. Even that becomes traumatizing because you keep hating yourself, thinking that my social perception is this, people perceive me as this, but this is something that I have done, right? So understanding that part is also important.